Hey, it's Kamisha back with another video about mental wellness. In this video, I'll be talking about accessing Medicaid or Medicare. So, according to the provisions from the Affordable Care Act, anybody in the U.S. is eligible for Medicaid, Medicare, or private insurance. So, I might have to do a part two to this video given the current efforts to repeal the Affordable Care Act, but until then, this is the information that I know of to be current. So, in my profession as a social worker, I've helped people to get health insurance, and I've also have helped people to navigate getting Medicaid and Medicare and finding out which providers they have cover cover Medicaid, use Medicaid or Medicare for medical coverage. So the first thing I think is to apply on healthcare.gov to see if you qualify for Medicaid, Medicare, or private insurance. I'll first say that Medicaid is pretty much for anybody who's not a senior. Medicare is usually for seniors or people who are differently able, and a lot of mental disorders count as disabilities, so you may be eligible for Medicare and Medicaid, I believe, if you have a mental disorder that I would have to find more information about. But once you find out whether you qualify and once you are secure, once they send you your medical card and give you a confirmation, the next step is to look into the services that are offered in your state with your Medicaid and Medicare plan. So usually on a website, once you get approved for Medicaid or Medicare, you'll have to actually choose a provider. So you have Humana, Aetna, Blue Cross Blue Shield. I think they provide Medicaid plans. Then you have like in Chicago you have like County Care. You have Meridian that also provide Medicaid plans. So you get the Medicaid or Medicare. Then you have a insurance provider that provides the Medicaid, and then you can begin to look for services. So sometimes that process can be confusing for people. It's like I got the Medicaid card. Why can't I use it? Because you still have to go through a provider, an insurance provider. So once you get all that taken care of, calling someone who works at the insurance company, and usually they have a number on the back of the medical card, or sometimes you can look online to see which providers in your geographic area accept Medicaid and Medicare. I will say that Medicaid and Medicare is not accepted by all providers, and that sometimes it's very intentional of not wanting to bill for Medicaid or to work with people who are of a low socioeconomic status. But also sometimes it depends on the area that you live in. So with me living in Chicago, there are plenty of providers that accept Medicaid. But if I lived in downstate Illinois, in a more rural area, that may or may not be the case. And then also finding out if you have Medicare, what part you have. There's part A, B, and D, and they're very specific and very different. And so really being able to recognize what your plan covers, I actually think that that is probably very high up on the totem pole of accessing services, understanding what your plan covers. And Medicaid does a pretty decent job of covering mental health, behavioral health services, but there still are things that they don't provide. So being able to know up front what they don't provide and what you would have to come out of pocket for is really important. And I'll also say that Medicaid and Medicare, the copays are usually really, really low, like less than $5. Not all the time, but a lot of the time the cost is pretty low. And if you're not sure whether you have Medicaid or Medicare, so sometimes people think that they've, I apologize about that. Sometimes people think that they've signed up for Medicaid or Medicare, and actually they haven't, or they started the process and didn't finish. And so calling your state, Medicaid or Medicare office to find out if you're even on the roll or on the list can help to get you closer to getting the care that you need. So I hope that this video provided you with some information about Medicaid and Medicare that can be helpful. And as always, if you have any questions, feel free to email me at info@sisterafia.com. Thanks for watching. Be well.